5 on your health, detecting colon cancer without a colonoscopy.
The American Cancer Society just updated its screening guidelines to include 2 new options. One's a blood test and the other can be done at home. Joining us now is Dr. Aparna Parikh from the Mass General Brigham Cancer Institute. Doctor, thanks for your time.
Thanks so much for having me.
All right, so what's actually changing and why now?
So I think the first thing I would like to mention is what is not changing. So I think what is not changing is the screening age is 45 for colorectal cancer. And that's really, really important to note, as we've seen over the last decades now, a tremendous increase in younger patients with colorectal cancer. So in terms of the what has changed, there are more and more tools now in our armamentarium for screening for colon cancer. It's really important to emphasize that the gold standard test is still a colonoscopy. But what ACS now recommended and put into their guidelines are a couple of other options. So they incorporated another stool-based option. So stool-based testing, entirely reasonable for patients, again, as screening. So no family history, no symptoms. There are a couple of different stool-based tests, one such as the Cologuard, another called the ColoSense. And these are tests that you can take every 3 years and look at different analytes in the stool. The other big addition was the addition of a blood-based test called the SHIELD assay. And SHIELD is detecting tumor-derived DNA in the blood. I will note that the ACS recommendations noted that the stool-based and gold standard colonoscopy, so direct visualization, is still preferred. But for some reason, if those cannot be done, the blood-based option is an option. One of the limitations of the blood-based test is that it has a lower detection rate at precancerous lesions, as well as a lower detection rate of early stage cancers. And the point in detecting, in screening, is to try to detect cancer as early as possible. And then if you have precancerous lesions, we can actually intervene with the colonoscopy. So patients are still offered a choice between stool testing and direct visual exam as the, I think, best test option for patients. But blood is now also an option, particularly for those who may not be able to do a stool-based test or a colonoscopy.
Understood. So this all warrants a conversation, obviously, between the patient, their doctor. But what symptoms should immediately prompt someone to seek out their doctor, even if they're below that screening age?
Any blood in this stool absolutely needs to be discussed immediately with your physician. Changes in bowel habits, unexplained weight loss, but those are 3 of the largest or biggest red flag symptoms.
And again, doctor, so 45 is still the recommended age, and
Yep.
the preferred method is a colonoscopy.
Yes, but again, stool-based also totally within and appropriate for guidelines. But I think at least getting one baseline colonoscopy is still what I would recommend.
All right. Dr. Parikh, thank you so much for joining us.